Mr. President, last week, the Senate began consideration of the Obamacare repeal resolution, which is the first step in the process of repealing the law. And Mr. President, it is time for repeal. 7 years ago, Obamacare was sold to the American people with a lot of promises. The law was going to reduce premiums for families. It was going to fix problems with our health care system without hurting anyone who was happy with their health coverage. If you like your health plan, you'll be able to keep it. People all across this country were told over and over again. If you like your doctor, you'll be able to keep your doctor. Also a promise and a claim that was made over and over again. Well, Mr. President, as everyone knows, every one of these promises was broken. Premiums for families have continued to rise. Millions of Americans lost health care plans that they liked. Americans regularly discovered that they couldn't keep their doctors and that their choice of replacement was often limited. But, Mr. President, these broken promises were just the tip of the iceberg. The law hasn't just failed to live up to its promises, it is actively collapsing, and the status quo is unsustainable. Premiums on the exchanges are soaring. Deductibles regularly run into the thousands of dollars. For 2017, the average deductible for a bronze-level Obamacare plan is rising from $5,731 to $6,092. $6,092. With deductibles like that, it's no wonder that some Americans can't afford to actually use their Obamacare insurance. Well, Mr. President, I've received a lot of mail from constituents in my state struggling to pay for their health care. One constituent contacted me to say, and I quote, "My Obamacare premium went up from $1,080 per month to $1,775 per month. A 64% increase, $21,300 a year for health insurance." Let me just repeat that, Mr. President. A 64% increase in premiums, or $21,300 a year for health insurance. $21,300. That's like paying another mortgage, or, Mr. President, that's a lot more than many people pay for their mortgages. And of course, that's before any deductibles or other out-of-pocket costs are considered. Another constituent wrote to tell me, and I quote, "Today I received a new premium notice for my Obamacare insurance. My policy rate for myself, my wife, and my teenage son has increased by 357%. 357%. Mr. President, the problems on the exchanges aren't limited to soaring costs, unfortunately. Insurers are pulling out of the exchanges right and left, and health care choices are rapidly dwindling. Narrow provider networks are the order of the day. And 1/3 of American counties have just one choice of health insurer on their exchange. This is not the health care reform that the American people were looking for. So it's no surprise that a recent Gallup poll found that 80% of Americans want major changes to Obamacare or want the law entirely repealed and replaced. Or that 74% of American voters ranked health care as a very important voting issue for them in the 2016 elections. Obamacare has not fixed our nation's health care problems. It has made them worse. The American people deserve better. Well, last week, the Senate started considering the Obamacare repeal resolution, and we're continuing that process this week. This resolution will provide us with the tools that we need to repeal the law, and then committees will get to work on the actual repeal bills. And then we'll work step by step to replace Obamacare with real health care reform that focuses on personalized, patient-centered care. Mr. President, one massive problem with Obamacare is the fact that it puts Washington in charge of health care decisions that should be made at a much lower level. Any Obamacare reform that Republicans pass will focus on fixing this. We're going to move control from Washington and give it back to states and to individuals. Health care issues don't have one-size-fits-all solutions. It's time to stop acting like they do. States should have the power to innovate and embrace health care solutions that work for the individuals and the employers in their states. And individuals should be able to make health care decisions in consultation with their doctors, not with Washington, D.C. Another thing we're going to focus on is breaking down the Obamacare barriers that have artificially restricted choice. As I said earlier, Obamacare has defaulted to a one-size-fits-all solution when it comes to health care. And that means that many Americans have found themselves paying for health care that they don't need or want. We need much more flexibility in insurance plans. A thriving health care system would offer a wide variety of choices that would allow Americans to pick a plan tailored to their needs. That would be a competitive system that gives people in this country more choices. And inevitably, what happens, Mr. President, in those circumstances, it pushes the cost down. We also need to give Americans the tools to better manage their health care and control costs. And of course, any reform plan has to make sure that small businesses have the tools they need to provide employees with affordable health coverage. Obamacare has placed huge burdens on small businesses that have made it difficult for them to thrive and even to survive. It's time to lift these burdens and free up these businesses to grow and to create jobs. Mr. President, our health care system wasn't perfect before Obamacare. We all acknowledge that. But Obamacare was not the answer. Instead of fixing the problems in our health care system, it's just made things worse. Republicans are ready to implement the kind of health care reform the American people are looking for. More affordable, more personal, more flexible health care coverage that meets their needs, and less bureaucratic. The American people are ready for health care reform that actually works, and that's exactly what Republicans are going to give them, starting right now. Mr. President, I yield the floor and suggest the absence of a quorum.